Good evening, ladies. Welcome once again. And for those of you that are watching, thanks for taking a few minutes to sit with us and listen about a conversation that we think is important enough to ask, would you give us 30 minutes of your time? And so we're starting what's going to be, I think, 5 episodes called Conversations About Anxiety. And if you have been with us during conversations about peace, you'll know that we spent, I think, 6 or 7 episodes talking about that subject. We're all Christ followers, so that will always be our lens. We have a biblical worldview. So when we talk about anything, it's going to come through that context and that lens, and this will be the same in that way. But once we finished our peace talks, we thought it was important. Why would we spend so many weeks talking about peace if there isn't a need for peace, and what's causing that need for peace? And one of the primary things is anxiety. And we thought it would be responsible and helpful if we just turned that conversation upside down and went, let's talk about the thing that is driving us toward peace at proportions that really I have never seen in my lifetime before. So conversations about anxiety, that's why we're here. And I have these 3 amazing women that have condescended to join me to have this conversation. So I want to introduce you to them first. And in my top left screen is the beautiful Summer Thurman. She's an educator. Right now teaching kindergarten. She just finished her first year of teaching, so she's grieving and celebrating all at the same time. There's never another first year. She's also newly married and smart as heck, and I'm so pleased that she is here with us, and she struggles with anxiety. And so she's here for lots of different reasons, but one of the reasons is to keep us honest in our conversations, to either correct or validate or whatever, and she'll tell us through the weeks a little bit about what it's like to deal with anxiety on a daily basis. So thanks, Summer, for being here. We have Michelle Telfer, who is not here with us. I'm reading that off an old list. Edit. We have Dr. Laura Cavarretta. That's awesome. A doctor of psychology, has a private practice here in Southern California. She was with us through the whole conversations about peace talks that we had, and was so invaluable to us, and know that she will be in these conversations as well. She specializes in addiction and recovery. So she comes with a very unique lens and expertise, and she'll be very valuable to you and to us during these conversations. So thanks again, Dr. Laura, for being with us. And Stacy DeWitt, Executive Director of James Storehouse. It's a nonprofit that serves those in foster care in Ventura and LA counties. You can visit her at jamesstorehouse.org and find out how you can make really a life-changing contribution to either a foster kid, foster baby, foster teen, aged out foster youth. So that's a huge community of people, bigger than you think if you don't know about it. So she's working in trauma, critical situations every single day. So she comes to this conversation also with a very, very unique and informed lens. So thanks, Stace, once again for being along. And Michelle, we miss you. There, I said your name, so we miss you. So today, the beginning of conversations about anxiety. And one of the things that I wanted to talk about first, just really briefly, is there's a lot of, I'm looking for my notes specifically about this. There are a lot of different kinds of things that we could talk about that are attached to anxiety, but we're talking specifically about anxiety. In other words, not necessarily depression, not necessarily fear, not necessarily sadness or being troubled per se, but specifically anxiety. So all those things I just mentioned will sort of, dovetail, interweave in and out of anxiety, but we're really focusing on anxiety and the unique thing that is. And I'm going to read a couple of definitions here. And Laura, you'll correct me if there's something super obvious to you that we're missing. Let's see, this is from, who have I got here? Oxford Clinical Psychology. I just pulled this, defining anxiety disorders. And it says anxiety refers to multiple mental and psychological phenomenon, including a person's conscious state of worry over a future unwanted event or fear of an actual situation. Anxiety and fear are closely related. Some scholars view anxiety as a uniquely human emotion and fear as common to non-human species. I think that's interesting for a reason that we'll talk about later when Jesus is talking about anxiety on the Sermon on the Mount. Another distinction commonly made between fear and anxiety is that fear is an adaptive response to realistic threat, whereas anxiety is a diffuse emotion, sometimes an unreasonable or excessive reaction to current or future perceived threats. So I thought that was interesting. Here's something from Psychology Today. What is anxiety? Anxiety encompasses feelings of worry, nervousness, or dread. Although unpleasant, occasionally bouts of anxiety, and Laura, you've talked about this before, occasionally bouts of anxiety are natural and sometimes even productive. By signaling that something isn't quite right, anxiety can help people both avoid danger and make important and meaningful changes. But persistent, pervasive anxiety that disrupts a person's daily life, whether at school, work, or with friends, can be the mark of an anxiety disorder. Nearly 1/3 of adults in the US will grapple with one at some point in their lives. Anxiety is often accompanied by depression, and the two share an underlying genetic architecture. So that talks a little bit more about different kinds of disorders, generalized anxiety disorders, panic disorders, obsessive compulsive disorders, post-traumatic stress disorders. So we know right away when we just put a word like anxiety out there, it's got a very broad base. And it's important to acknowledge that. Here's Wikipedia's definition. Anxiety, in fact, when I asked Siri today, I was out hiking, I thought, what would Siri say? What's anxiety? I just asked. She knew. I think she quoted Wikipedia, though. Anxiety is an emotion characterized by an unpleasant state of inner turmoil, often accompanied by nervous behavior, such as pacing back and forth, somatic complaints, and rumination. It's the subjectively unpleasant feelings of dread over anticipated events, and on and on and on. But that was, so anyway, that gives us sort of a frame of reference, and we'll try to dial in a little bit more so that we're clear about what we're talking about, maybe more what we're not talking about. Let me go to another page here. So not depression, not fear, not sadness, but you can see how those things can be characteristics of anxiety. And we're putting on the table this supposition that anxiety is so pervasive that while I don't know that it would technically be not characterized, identified as an epidemic or a pandemic, but it is at the proportions that would qualify for one of those kind of things. It's that big of a deal. So Summer, I just, as a person struggling with anxiety, if I said anxiety has reached epidemic proportions, would you agree?
Honestly, I would. I would probably call it, though, a silent epidemic. So the way I would kind of describe that is there's a lot of people, like a ton of people that are struggling with it, but don't know how to express it. So they're struggling in silence. So that's kind of the way I would describe it.
So a silent epidemic, and you come to that conclusion because why?
Well, actually, one of my recent experiences that I had, I posted on social media about, my struggles with anxiety. I was blown away at the amount of people that reached out to me saying they struggle with it. And the only reason they felt comfortable sharing that with me is because I'm someone that struggles with it as well. So I know it's a common generalization, but for those that struggle with it, we're all struggling in silence because sometimes there's a lack of, knowledge or education on what's going on inside of our minds.
Mm-hmm. So there's definitely when you go, you're struggling too. There's
Yes.
some sort of connection there where you feel like you can be vulnerable and you wouldn't in another situation.
Mm-hmm.
Yeah, I got it.
Yeah.
Well, Stace, where have you personally seen evidence that leads you to believe anxiety might be a full-fledged epidemic?
I was thinking about that today, and I think that it's in every vein of my life. If I think about it for a minute, like in my own home, there are those that have a diagnosis of anxiety disorder, an extended family. If I jump out to my church family, I'll often meet with those struggling and just pray with them and listen to them. If I jump out to my James Storehouse staff, definitely. If we jump out even further to the clients that we serve, that anxiety could be the underlying factor that's affecting the parents who often choose drugs and alcohol as a way to mask their anxiety. So they're losing their children because of that. So I see it in every vein of my life. There are definitely times where I myself struggle with it. So it's pervasive. I see it everywhere. And I'm really looking forward to this series and learning from each of you and hearing about your experiences and also just some practical tips and some education from Laura as well.
Mm-hmm. Summer, how about as you look at the different rings that make up your world, are you running into people that are dealing with anxiety?
I'm not, unless I share that I'm dealing with it.
Gotcha.
So I don't see it unless I express that, I'm going through something like that.
And then suddenly they come out of the woodwork.
Suddenly everybody has it. Everyone's struggling with it.
Okay. You know what's interesting to me? Like, I expect to see that in the youth that we serve, they've experienced complex trauma. So I know that affects the brain and then how they relate to stress. But it's really interesting to see that some of our volunteers, some of our youth that have not experienced complex trauma have had very beautiful, privileged lives that they themselves deal with anxiety and stress as well. So it's just really interesting to see like how pervasive it is.
Well, Dr. Laura, you're obviously dealing with clients that, among other things, I'm sure are struggling profoundly with anxiety. It lives in my home too. I don't struggle with it long term, but I've had pockets. I've had pockets of panic attacks and other pockets of time where I've been under extreme duress when a particular situation would come around. Those are not my norm, but boy, they'll shut you right down, and life just kind of comes to a screeching halt when you're going through it. And it's just scary as heck, especially if you don't have a frame of reference for what's happening to you. So help us understand, Laura, what's happening clinically when we're suffering from anxiety?
Well, it's interesting because, like you were saying earlier, there are some aspects of anxiety that are supposed to actually help us, and it's probably more of the fear. So it can be broken down into flight. There are some things that we should be avoiding. That would be the flight aspect. The fight, we need to gear up. Our adrenaline gets going, and that's to help us. If we're in a very dangerous situation, I'm not sure how much that would help me, no matter how much adrenaline I have flowing through my veins. So, and
that's why you're the doctor.
Also freeze, and yeah. There's also freeze, which was a new one on me. I always thought about it as, like a flight or a fight, but there's also freeze where, adolescents were telling me, my mind goes absolutely blank. My dad starts yelling and I don't know how to respond. So that to me was really helpful too. It's flight, fight, or freeze. We were designed to have those for protective instincts. But as you said earlier, when you talked about the difference between fear and anxiety, fear is more of a real threat. In fact, I do these continuing education seminars, and they have little examples, and they'll say, Johnny is going through this, that, and the other. Some of those are very natural, developmental. I don't know if you guys remember your kids, like maybe my daughter did the checking all the closets, before she would go to and make sure there's no monsters there. Separation anxiety is prevalent, but that's more prevalent for kids that are 12 and under. So I thought I'd probably talk a little bit more about the anxiety that is more pervasive in teenagers and adults as well. And exactly what you said, Annie, that the statistics is 1 out of 3 teenagers, and you just mentioned 1 out of 3 adults. And can you imagine if 1 out of the 3 of us had, COVID? I'd call that a pandemic, more than a pandemic for sure.
Yeah.
So that a lot of symptoms aren't recognized, and that's why people sometimes, the first time they might experience a panic disorder, they end up in the emergency room, because there's a real physical part to it, and we're not educated enough about anxiety, where they really do think that they're having a heart attack and they end up in the hospital. Mm-hmm. The kind of an interesting thing about the graduate school that I went to, so Fuller Theological Seminary had the Graduate School of Theology, the Graduate School of World Mission, and then there was a really generous donation by a woman who suffered from panic attacks, specifically with bridges. And she lived in Seattle. And I don't know if you all have been there or not, but it's pretty impossible to get around without going bridge there. So she was, and it's very public knowledge, so I can say it. She was the wife of Weyerhaeuser, a very big lumber company. Mm-hmm. See, after that, I heard about that. You just see it everywhere, lumber and paper. Mm-hmm. And she got such benefit from a therapist that she gave him this large donation to start Fuller Graduate School of Psychology. So we were founded by a donation from someone who was treated and recovered from anxiety. And I think that's pretty awesome, that it was personal to them, that they wanted to create a venue where they could train people to help with anxiety with a therapist. So a lot of these symptoms you mentioned, Annie, already, I'll go over generally what the anxiety symptoms are, and sometimes they're not recognized. And I want to delineate it just a little bit in an effort to kind of help us understand the different aspects that we might come across. So general symptoms, and you mentioned a lot of these, Annie, excessive worry, persistent fear, avoidance behavior is huge. Right now, we're seeing that a lot. People that are not going out anywhere, even if they could, like in a park. And a colleague of mine, she was telling her client, she's like, do you really want to develop agoraphobia, which is fear of open places? And that's something that's happening right now, is people are, it's getting reinforced that we really should avoid open places. Caregivers, difficulty concentrating. Public school, right? Summer, people that suffer from anxiety, a lot of difficulty concentrating, and they might get test anxiety, irritability, temper tantrums, be anxiety. They absolutely can. Sleep difficulty falling asleep, nightmares, cognitive distortions. They might see people are against them. People are out to get them because of all the fear that's around them. And behavioral compulsions like OCD. OCD is not, it's no longer categorized in as an anxiety disorder per se, but it does have a lot of those components. I mentioned separation anxiety, which is under 12, very specific phobias, more so the fear of something in particular. PTSD, if someone tells me they have PTSD, I'll ask them what from. because usually it's from a past trauma that gets stirred up again when they come across something that is familiar. Right now with, I don't know if you guys have heard this too, but all the fireworks that are going off, you know, we have a lot of our veterans that are getting very upset about that. And social anxiety, I see social anxiety so much in my adolescent clients, where they're very fearful to start a conversation, join a conversation, speak or perform in public, attend social events. People are very self-conscious these days. I do think that that's social media, where they're looking at what everyone's doing, how they're performing, what they look like. And then if there's a misstep on the part of an adolescent, that can go viral. I think it's a very anxiety-producing age that we're in with all the scrutiny that we have. So social anxiety is huge. Panic disorder, experience of recurrent, spontaneous, and seemingly sudden and unexpected panic attack. The hallmark of panic attacks is there doesn't seem to be a particular trigger to it. Right. And that's why it can be so disturbing. Like, people will have a panic attack, they have no idea what brought that on. And I experienced that actually myself. I went through a period of time where I was waking up in the middle of the night, and I felt, I did move recently, but I felt just this crushing weight on my chest. And it took me a while to get through that. Once I knew that it was a panic attack, it was easier. I could tell myself, it's just a panic attack. It's going to be over in 20 minutes. My blood pressure just dropped and it's going to come back up. If you can, I couldn't do it in the middle of Rite Aid, but you know, if you can lay down with your knees up for 20 minutes, you know, that's more helpful. But once you know that you're not going to die, you're not having a heart attack, that's a little bit easier. Then secondarily, people become worried about having a panic attack. Right. And they start to avoid the places where they did have a panic attack. There was a woman in my choir at Church on the Way, and she always had to be on the very edge of the choir's very large choir there. So she was in full sight of a door where she could escape if necessary, and possibly agoraphobia. Ultimately, where they just don't want to leave the house for fear of having a panic attack once they go outside. Generalized anxiety disorder, I think, is more what we're talking about. And that is a chronic, exaggerated, and uncontrolled worry that is more intense than the situation warrants. Could relate to academic functioning, could relate to your health, could relate to well-being of family members. And again, the symptoms are restlessness, being easily fatigued, difficulty concentrating, mind going blank, irritability, sleeping problems, muscle tension. So a lot of physical symptoms. And I was reading too that it can lead to actual physical disorders. So you can see how these things can build on each other and affect our ability to function in this world, and can affect our ability just to have very normal relationships because of all this avoidance that's going on.
Right. Yep. Yes. I mean, it sparks so many different thoughts. We could spend 10 weeks talking about how could we not take something like this seriously and have a really interesting conversation about that. But I don't think that's our call here. But hopefully, the more people that are having these conversations and putting the reality of the pervasiveness of anxiety on the table will at least do its part in raising overall awareness. So for the folks out there that still just don't recognize it as a legitimate thing to address, and get whatever kind of education they need as an individual to be able to help somebody in their household, themselves, somebody at their workplace, because if they don't know it yet, they know somebody struggling. And maybe that's just a good thing to just pause for a second. If you don't know somebody, you just don't know they're struggling yet. But somebody in your world, and most likely many someones in your world, are dealing with anxiety on some level, and are feeling, especially if you don't know, chances are feeling alone and unable to share a really critical piece of their life with you. So we just plead with those that are maybe still going, I just don't know if this really is a legitimate thing, that you might open up your hearts, your mind to the fact that it is most certainly here. And it is just so pervasive. We're already saturated. So come join us in this conversation. I find great comfort in the fact that while we might see anxiety and the manifestation of it uniquely in the unique days that we live in, it is not a new thing. And we have loads of evidence here that tells us that it's something that we will most likely grapple with. And I was just doing a little bit of homework. I use the ESV translation. The word anxious shows up 27 times. The word anxiety shows up 6 times. But words like worry, words like, what was I looking up today? Troubled. All those things would probably be in that same vein of a description of anxiety, or what it would be like to be anxious. The Lord directed Isaiah, the prophet, to address people who have an anxious heart. That's in Isaiah 35. He spoke through the prophet Jeremiah about anxiety. But the scripture that I think is most relevant, at least that's most relevant to me today, is the Sermon on the Mount, and specifically in Matthew 6, because Jesus talked so much about anxiety. I think he uses the word 6 times in that little chunk of that sermon that he gave. And I can't imagine him speaking about it as thoroughly as he did if he didn't understand the people that he was talking to were struggling with anxiety. And even to crippling degrees, if we think about the kinds of things he's addressing, on the most basic level, the people he was talking to were anxious. And he was trying to lovingly encourage them that they didn't have to be. And he was offering himself as the remedy. And the other thing I thought was interesting too, one of those definitions earlier that delineated fear as something that even subhuman species grapple with, but that anxiety would be a thing unique to humans. I find it interesting that in this passage, Jesus, he wants us to respond to life as if we didn't even have the ability to be anxious about a thing. He compares what he would like to see from us to a species that doesn't deal with anxiety, that just doesn't have any cares. And they're not even really constructed to think or that they would be in need. I think it's interesting that Jesus uses a subhuman creature as an example to talk to me about anxiety. But just listen to these words. They're so familiar. This is Matthew 6, starting in verse 25. Jesus talking, therefore I tell you, don't be anxious about your life. And he must have had a way about him, because if I was anxious and he didn't have a way about him, I think I would have been upset with him right out of the gate.
Yeah, just
I have an idea that my heart is open toward him. Don't be anxious about your life, what you'll eat or what you'll drink, or about your body, what you'll put on. Is not life more than food, and the body more than clothing? Look at the birds of the air. And I just be going, look at the birds of the air. They're not humans. But he must have been so compelling. Look at the birds of the air. They neither sow nor reap. They don't gather into barns, and yet your heavenly Father feeds them. Are you not more valuable than they? And which of you, by being anxious, can add a single hour to his lifespan? And why are you anxious about clothing? Consider the lilies of the field, how they grow. There's another species that doesn't have the capacity to be anxious, and he wants me to consider them. So anyway, he goes on and finishes that word by saying, therefore, don't be anxious about tomorrow, for tomorrow will be anxious for itself. Sufficient for the day is its own trouble. And I would say if I didn't love him and know him the way I did, well, you just don't know what it's like to be me. But he does. And so there's a component that we have to consider, maybe ultimately the most significant component, that Christ is offering himself as the antidote for, I didn't say that word right, for anxiety. And he's saying, you put yourself in my hands and you don't have to be anxious because I'm going to take care of you. Even if you don't know anything about tomorrow, I do, and I've got you. So we can't not talk about that, but that doesn't dismiss the very real phenomenon that anxiety is, and the clinical issues, the psychological impact, the mental impact, the physical impact that it has in a person's life. And so we want to approach it holistically. We want to know what Christ has to say about anxiety, and we want to use the smart people that he made and resourced to help us too. We want the therapists, we want the doctors of psychiatry, we want whomever is out there for us that can help. And we want to get an education so that we can help our loved ones who are struggling. Any closing thoughts for us, Laura, as we launch into this? We're going to be getting into, in future weeks, just in case you're wondering, I just want to give you a couple of topics that I think are coming up. Our next one, we're going to be focusing on an anxiety-laden generation. Summer Thurman's people are struggling. Too many of them. Who are they and what are they experiencing? We want to spend an episode talking about that. And then we're going to talk about anxiety apathy. We really, I think, would benefit all of us to take one episode and talk about the fact that there's still too many of us out there that aren't taking this seriously enough, and to the detriment of those who are struggling. We want to spend an episode talking about resources. There are a lot of people doing a lot of responsible research. There's help to be found for you if you need to be educated so that you can help someone. There's stuff for you if you're struggling and you need to find out, how do I get help? So we'll do our best to funnel all the resources that we know your way. And then I want to finish by just talking about anxiety recovery. Right? Laura talked about a lady that struggled profoundly and doesn't anymore. So what can we expect and anticipate and hope for to come up from, and maybe even recover from what might seem like something that is right now debilitating? And if you can't, can you learn to live with it? Can we still be productive, or can we beat it? What are our options out there if we're struggling? So those are huge conversations, but we want to at least start them, and then hope that if one of those really hits the mark for you, that you'll take the baton and run and go find out what you need to know. Okay, Laura, what do you have to say to us before we finish up here?
I want to just key in on what you were saying about, the birds of the air and the lilies of the field. And the difference is they are very present today. And mindfulness is very, very important. I'll ask clients, do you have what you need today? So when we talk about anxiety and that it's out of proportion, it's because we're imagining all kinds of things that could possibly go wrong. So just to kind of give some hope on a very challenging subject today, be present today and know that he's with you, he's for you. Those have been my meditations. if you know he's with you, you know he's for you, he provides for you. The Lord's Prayer says the same thing. Give us what we need today.
That's right.
So I would just encourage everyone, in the meantime, we've got a lot to cover, but in the meantime, be mindful. He's with you. He's for you. You have everything you need today.
Mm-hmm. And Stace and Summer, give us one or two, in light of that, what are one or two things you do to ground yourself or to help somebody that you're alongside who's struggling to get grounded in those moments when they're unraveling from anxiety? Summer, you go first. What do you do to ground yourself?
I'm still learning how to ground myself. Actually, I've been practicing, self-care routines to help ground myself in those moments. But to be honest, I don't have an answer yet. I'm still figuring it out.
So Laura,
me,
yes.
go ahead.
No.
For me, in those moments where I'm feeling particularly anxious, I've learned to do some breathing techniques that are really helpful for me, and I've been able to pass that on to others. That's really grounding, and it really helps you to become present in the moment.
Mm-hmm. So Laura, what's like one or two it's coming on. How do I begin the process of grounding?
So one thing that people do, and I'm probably going to get the numbers wrong, but they'll look at 5 things they can see right now here. It's maybe 4 things you can hear. Somebody's going to correct me. You can smell, things you can taste, because you want to stay right here. Because anxiety, remember, fear of the future, fear of something going wrong. We're right here. The other thing that people do, like with the deep breathing, same concept. They're going to do the deep breathing because that's all they're going to think about right now. And then I'll go through this more in detail, Summer, like as we go along. But there's something called anchoring. I don't know if you guys have heard of this or not, but where you might, it's something you want to be able to do anywhere. And a really good hypnotherapist I know sort of taught me this technique where you imagine in your mind a very calming place, probably your favorite place, and you tie that to something like, just maybe putting your fingers on your wrist like this. And you pair that calming image with that touch over and over again. And eventually you're in a meeting, you're giving a talk, you can just do that. And that you're conditioned now to be in that calm state. So that takes a little more preparation or a little more work, but it's worth it.
Mm-hmm. That's great.
That's cool. I've already learned so much, you guys.
Well, if you're watching and you're struggling, we want you to know that that you are seen and loved by the one who created you, that God sees you and loves you, and that his desire for you is that you wouldn't struggle, that you would live free and present and joy-filled and at peace and content. Those would be the things that would be on his heart for you. But he's also sort of set things up for us to look after each other. And so we're 4 women who call God Lord. So we're his. And as Christians, it's our job to look after each other and then to turn outward and see who the Lord would have us look after. So if you know someone that's that you trust, that you would be willing to maybe sit down and have a conversation with, then just know that we're going to be praying for you, that God would lead that, even if you're not even aware of the Lord, but that he would lead it even if you're unaware. You can reach out here, respond on this YouTube post. We're going to be providing some resources. If you just look right underneath this screen that you're looking at, you'll see some resources that are trusted where you can go and begin a journey of exploration and finding help. But ultimately, we would be doing you the biggest disservice by not pointing you toward the one who made you, because God's ultimate desire for you is that you would come into relationship with him, the one who made you. And you do that simply by acknowledging that he exists, that he has provided a way for you to be in relationship with the Father, and open your heart to him and say, would you come and be the ruling force in my life? Would you come and from this day forward be Lord? And if you pray a prayer like that, if you make a decision like that, we would want to know. And if you know a trusted Christian, please go and tell them so that they can help you begin this journey with the Lord. And there are also resources below here that will help you in that regard too. Thank you so much, ladies, and thanks those who are watching. We are longing for you to find relief. And for those of you who have family members, loved ones, coworkers who are struggling, we're longing for you to be resourced, to be able to come alongside them and help. So that really is the whole impetus behind us having these conversations. So we'll see you in a week with another conversation, but thanks for joining us today, Conversations about Anxiety. All right, God bless you, everyone.